At this point, we've talked about ligament injuries, muscle and tendon injuries, as well as bone. Now we have the last couple few that are kind of in their own category, okay? So they're a little bit more unique. The first one that we have is medial tibial stress syndrome. That sounds like a mouthful, okay? But break it down, all right? So far, we've seen a stress fracture, okay, where that deals with overuse. Tibial looks like tibia, and medial is talking about the inner part of that tibia. Half the word, right? Half the problem right there, okay? Medial tibial stress syndrome is commonly referred to as shin splints, okay? It's caused from repetitive activity, having bad shoes, maybe pushing yourself a little too hard or trying to get back in shape after you've been inactive for a little while. And you're having pain along your tibia, okay? Signs and symptoms: it hurts to run, it hurts to walk, you kind of have that burning sensation when you're trying to run. It's just pulling on the muscles that are attached to the tibia. How we're going to treat this: you can do the Price method as always. Decrease your running. Maybe you started a little too fast into activity. You need to work your way up. Shoes are a big part. If you don't have proper cushion, getting inserts, or if you're running on too hard of a surface, little changes like that can really make a difference in how you're feeling. So here's a quick picture. This is just showing you right here along the tibia where those shin splints occur, okay? People can have pain in their shins all over the place when they're running, and the term is always shin splints, but that's not necessarily what it is. But it's basically just you're overstressing the muscles in your lower leg. And so with some modifications and some rest and doing the ice, usually you'll see a lot better. Now, one of our next conditions is definitely unique, and it's definitely a medical emergency. It's anterior compartment syndrome. Your lower leg is filled up with little compartments that all the muscles, the nerves, the blood vessels, all of those fit into, okay, around the tibia and the fibula. Okay, they're kind of like split up into different groups, and this connective tissue that's holding everything in with certain trauma can start to swell. Well, if you have any swelling in an already tight place, it can start to cut off things like nerve supply. Those nerves won't get the messages anymore. It could cut off your blood supply. You could start to lose circulation. And usually we're going to see this from severe impact. We see this sometimes in soccer. If you get hit in the shin and it swells up nasty, and then maybe you get hit again, and it's just kind of like, instead of it healing like it should, it's too much trauma. Sometimes this can be caused from overuse, but more times than not, we're going to see this with some severe impact, okay? There's going to be a lot of pain, okay? It's going to swell a lot. The pressure is going to be very, very painful when you're trying to walk, okay? And depending on what's being cut off, if it's the nerves that are being cut off, you won't be able to activate those muscles like you should. If it's your blood flow, then you're going to have some circulation issues. This is a medical emergency. Send them to the ER, not call and schedule an appointment with your primary care physician. Emergency room quickly, because they're going to have to cut open this area and relieve that pressure quickly so you don't have permanent damage. Okay, and here's what this looks like. You can see this foot is very red, very swollen compared to this one. Okay, they literally take a scalpel and make a large incision, and it exposes everything just to relieve the pressure, just to give that fluid some place to go. It leaves nasty scars. We've had soccer players with this when I was in college, and it is one of those situations where it can be very, very problematic very, very quickly. Our last one, very, very common. We've talked about it a million times already. contusions, those bruises, okay? They hurt. There could be swelling, definitely discoloration, but we need to ice, all right? Rest and ice those areas, but protect them. If it's your shin and you're in a sport like soccer or field hockey, or you're a catcher in baseball and softball, wear your shin guards like you should, and you won't get those bruises. So here it just shows you that awesome discoloration and that bruising, all right? That concludes all of our foot, ankle, and lower leg slides. I know it was a lot. Break it down, re-watch our videos, and let's get ready to test.